We are live. Oregon Trails to Medicare Gold. It should have been. It should have been Oregon Trails to Medicare Fails. Oh, it's late here. Trying to reach those Oregonians. Anybody from Oregon want to be on the stream tonight? Oh shoot! I was gonna have somebody call in. Somebody call in. You can still call in. Oh, we got somebody. The one person is lingering in the background. One person. Get your little phone out and call 336-892-8370. Oh, they left. They didn't want to be on. They didn't want to be on. No, no. Oh, Oregon Trails to Medicare Gold. Well, let me just say, put some stuff in the comments. Ask me some questions. You know, it says I had Copilot. I guess Copilot is located in Washington, though, right? Not Oregon, since it's and you can see in my background that's Mount Rainier over there, right there. That's Mount Rainier, which is in Washington. But I will tell you, Tim and I, me and my husband, went on we started in, I guess we started in San Francisco. And we drove from San Francisco all the way to Seattle, Washington. And because we have a dream, we have a retirement dream. That's why I'm doing this. I need to get new clients. I need new clients for Medicare. People turning 65 would be great. According to Copilot, my AI assistant, there are 720 people per day turning 65 in Oregon. All I want is 400. They don't have to come all from Oregon. I would prefer them to come from North Carolina. Let's spread it out. Spread out the good news. Let's spread it out. 100 in North Carolina, 100 in Virginia, 100 in Alabama, 100 in Texas, and 100 in Oregon. And then we would have more than enough of my goal. Now I have a goal of 400 new clients for this upcoming, well, between now and January 1st, 2026. Otherwise Timmy may have to continue working. And I don't want Timmy to have to do that. Now listen, the reason Tim is even having to work on is because of this. Let me just say, I was diagnosed with breast cancer. It was probably, I knew somewhere in the middle of May. I didn't need a test to tell me that I had breast cancer. I knew as soon as let me just say, I flippantly, not thinking, flippantly thought about, okay, Tim was planning on retiring the 1st of June last year. And sometime, like I said, in the middle of May, I I did an exam on myself, and I found the tumor. And to say that it was disheartening and scary and everything else, you know, I can't overstate it. But part of everything, and honestly, the whole last year, I spent just trying to get well. And by the grace of God, God has brought me through. Um, I mean, I am cancer free at this moment. Um, I can't tell you how happy that makes me. So, you know, when you're thinking of cancer and having to face it, then, you know, these are things that you just worry. You don't worry about anything other than trying to take one step at a time, one day at a time, and you embrace every day that you have given to you. I can tell you even now that every day is precious. Every day is precious, and you know, you may or may not want to help us, but as a result, Timmy had a sacrifice. He sacrificed, and he worked because I was on his insurance, and of course, you know, when you get cancer, you know, the only thing that I probably could have gotten would have been Obamacare, but thank God my husband laid down his life. Tim laid down his life for me to be able to have insurance. And I mean, you know, I don't know. Would other husbands do that? Probably some would. But I know there's probably some that would not. They would not embrace that. And, you know, it was a huge sacrifice for him to do what he did. And so now I am endeavoring on my quest to get to 400 new clients by the first of next year. It's easily doable, maybe in the AEP. It's easily doable. You know, according to Copilot, my AI friend, they said, "Oh, Michelle, it's really, really doable, especially if you're willing to put in this much work." And let me tell you about my work that I am willing to put in. I am going to do over the next 100 days. I am going to be doing 4 seminars on YouTube, live streams. So if you know somebody, maybe you're not turning 65, or maybe you have somebody, maybe your grandparents, your mom, your dad, your uncle, your aunt, maybe they are turning 65, or maybe they're already on Medicare, and maybe they might, you know, say, "Hey, look, this individual," and let me tell you, I do have quite a bit of experience with Medicare. I've been doing this since 1997. So I've been here a while. I've done it a lot. And I am an independent agent. I'm not locked into one particular company. So I can shop for you. These are things that I can do for you. But it's not, I mean, there's tons of agents out there. If God is putting it on your heart, God puts it on your heart that you want to support us in our quest to make Timmy, push him into retirement. We got to push Timmy into retirement. We got to push him forward. So, and Tim is scared. I am scared. Can I say something? Retirement can be very, very scary, and it can be scary when you're looking at trying to decide what type of Medicare plan you are going to have, because you have options, and sometimes options can be intimidating. Now, where I was going with this is we plan to go ahead and do some traveling when he retires. Um, and I can do my job from just about anywhere. I don't have to be, as long as I have an internet connection, a computer, an internet connection, and a phone, I am good to go. So I can work very much anywhere, flexible. Um, so I plan to do that, but we will plan to travel. Now we've got a little doggie named Zoe. Got a little doggie. Thank you for stopping in. Got a little doggie named Zoe, and we have to take care of her. So, what I was going to say is I don't know, I think it was back in 2007 or so, but we went to, flew into San Francisco, and then we drove all the way from San Francisco to Seattle, and on the way through, we went to Oregon, of course. And I'm not sure. I can't remember where we stayed. We stayed out in the middle of nowhere. I do remember that. And it was in the southern part. But we stopped, and it was, I think, in May. Like I said, I think it was 2007. But we went to Oregon and we saw Crater Lake. And just let me say something about Crater Lake. Crater Lake is the most beautiful lake I have ever seen in my entire life. It is absolutely gorgeous. And let me go back up here. Some interesting facts about Crater Lake. We went in May, and I will say they had the snow pushed over to, it was a bank. It was a huge bank, and it was about 9 feet of snow that was plowed up and over to the side. But we went and took a picture of us on Crater Lake, and that water was the bluest. It was the most gorgeous blue I think I have ever seen in my life. It says, and actually, what makes Crater Lake so special? It is the deepest lake in the U.S., and that's why it was so blue. It was so dark, dark blue, and it has 1,949 feet. It says it's not just deep; it's hauntingly still and pure, fed only by rain and snow. It was born from a volcano around 7,700 years ago. I don't know how they determined that, but evidently they did. Mount Mazama erupted and collapsed, forming the caldera that became Crater Lake, and evidently crater. There are no rivers in or out. The lake's water is replenished solely by precipitation, making it one of the clearest lakes on Earth. And it has Wizard Island, a cinder cone rising from the lake. It looks like something out of a fantasy novel. I'll be honest, I don't remember the Wizard Island part of it. I'm not sure, but we just looked down at it, and it was just I will attest, it was the most beautiful. We were on the rim around the top of it, and looking down, and it was absolutely gorgeous. They say the best time to visit is between July now to September for full access and clear views. So snow blankets the part from October to June. with up to 42 feet of snowfall annually. That's a lot of snow. And like I said, there was about 9 feet pushed over to the side when we were there in May, and it's amazing. So just absolutely amazing. Let's get into a little bit of Medicare. Part A covers hospital stays. There's 4 parts to Medicare. There's Part A, there's Part B, and that's original Medicare. But Part A is for the hospital stays, and hospitals stays, you can think of it as your lifeguard at Cannon Beach. Okay. Part B is your outpatient care, like having a mechanic and grants pass for regular tune-ups. That's what it says. Part C are the Advantage plans, and Part D is the drug coverage. With the Advantage plans, they have optional extras that can help folks in rural areas like Baker City access care. Here's a fun fact. 890,000 Oregonians are enrolled in Medicare as of 2024. Approaching 1 million. They're approaching 1 million right now, currently about 890,000 people. There are, I'm sure, some very rural places in Oregon. And, this is one of the things that you may be wanting to think about is, okay, should I go with original Medicare or the Medicare Advantage plans? Now, the Advantage plans, if your doctor is in the plan and your drugs are covered by the plan, then it may be an option that you can have. But when you have original Medicare, most doctors accept Medicare. And so when they accept Medicare, they accept the Medicare supplement. So you would have coverage that it has more extensive coverage, original Medicare does. The Advantage plans are a lot of times very, well, unless you have to use them, they are the most inexpensive way to deal with Medicare. Because with original Medicare, you're going to have a Part B premium typically, and you don't typically have to pay for Part A with Medicare if you have enough work hours that you've paid into the system. Typically 10 years or 40 quarters is what you have to have paid into Medicare. So, if you have someone that has not paid into the system, it can either be them or, if they are married, their spouse. So, that's one thing that you might want to think about as far as you want to make sure that you have at least 40 quarters of paying into Medicare, so you can get your Part A paid for. The Part B changes each and every year. This year, the lower part of it, and it goes up gradually according to your income, whether you are a single income earner or a joint owner, like you're a joint earner, like someone who's married. If you have questions on that, I can help you with that. You can go to my website, www.michellemorar.com, and put in the question, and I'll be able to answer it, whatever you would like to do. But you have A, B, C, and D as far as the things that you need. Now, if you go with original Medicare, you would probably want to look at a Medicare supplement. And you definitely want to get the Part D, because if you don't, when you've already signed up for the Part A or the Part B, then you will possibly have a penalty. And when Medicare puts on penalties, they never go away. So that's why you need a professional like myself. If you don't want to deal with me and you don't want to help Timmy make it to retirement, then basically, you would still want to use an independent agent like myself to help you go through, because there are a lot of pitfalls going through Medicare. A lot of pitfalls. One thing that was said is Oregon is a leader in healthcare transparency, which benefits retirees trying to compare plans. The thing about it is if you're looking at a Medicare supplement, they are all standardized. So one plan, G in North Carolina, is going to cover the same exact thing in Oregon. It just depends if you are traveling or whatever, what you might want to go and do. But there's no network that you have to have when you have original Medicare. 97 to probably about 97% of all doctors and hospitals accept Medicare. And if they accept Medicare, then your supplement would pay on it. If Medicare does not pay on something, then that's where you would have problems and you would have to pay out of pocket. Now, that's very important that you understand that. Sometimes your doctor may ask you to take some type of test or a whatever, and he may suggest that you take a test, and it is not covered. So you've got to make sure that it is covered under Medicare before you proceed, because that is one area that some people get, okay, I thought Medicare paid everything, and it doesn't, and then you have to go through an appeals process and all this. So before you're doing certain tests, like certain things, like certain, even a lot of times Medicare will say, okay, you can only have a mammogram one every year. And then the doctor says, well, you need to have another one. You need to have a second one. Medicare may not pay on that, so you have to make sure that it is covered. So just wanted to let you know that. It said to make a note that this retired logger near Astoria opted for a Medicare Advantage plan because it included dental coverage, and that is true. A lot of Advantage plans include dental coverage. They'll include maybe so much to pay on your glasses or whatever, because Medicare does not pay on those things. He said because bad teeth make bad fish stories. I don't understand. Bad teeth make bad fish stories? Because you're smiling? I don't know. One thing that I will say that I learned during this time, Oregon's Medicare Savings Program has helped over 160,000 residents last year reduce out-of-pocket costs. Now, there are plans that have extra help, and with extra help, you are able to get some additional help on your Part D premiums. So, those are some areas that some people, let me just say this, typically speaking, unless you're turning 65, you will, and you want to go into a Medicare Advantage plan, you have opportunity to go into it from, you can change your plan from October 15th through December the 7th. That's the time that you can change your Part D plan, your drug plan, or your Medicare Advantage plan. Otherwise, you're going to be, most of the time, there are exceptions to be locked into that. They started at the first of the year and you're locked in. A Medicare supplement, if you choose a Medicare supplement, you can choose to change anytime you want to change as far as that, as long as you may have to qualify with your health. So that would be that may be a point where you may not be able to change because of your health conditions. But when you're turning 65 initially, there are no underwriting questions. So that could be a very good thing for you to get a Medicare supplement at that time. If you have questions, if you have concerns, you can go to my website, www.michellemorar.com. It's in the details in the description of this YouTube live. If you don't want to if you don't want to go to the website, you can also give me a call at 336-892-8370 or text me. I don't know. I wonder. I'm not sure if it takes a text or not. It's a special dedicated number for Medicare for me. So if you want to reach out to me, I can answer any questions that you may have. So if nobody else has any questions right now, I'm going to stop this live. And like I said, I'm going to be running this for the next 100 days. Going to be doing, I'm talking about Saturday and Sunday. I'm going to go for the next 100 days. 100 days. Try to get some people, a little bit of information out to people. 10 a.m., 1 p.m. Eastern Standard Time, or 8 p.m. and 10 p.m. Eastern Standard Time. You can convert that into any of your particular time zones. So, there you have it. Ready to go. Nobody has any questions, so I'm going to end the stream now. See you tomorrow.